Hi, this is Paul Wise and welcome to the Lawn Vets video series. In this short video I'll be sharing with you some information on vaccinations. Many pet owners wonder why we vaccinate our pets and how often we should be boosting their immunity. Understanding how a vaccine works can give you an insight into the exact reasoning behind their usage. A vaccine consists of a dead, or alternatively an alive but weakened pathogen that we are vaccinating your pet against. Generally this is a bacteria or a virus. We understand that if this pathogen were to enter your pet's body, it would cause disease. If your pet has not been vaccinated, these diseases can prove to be fatal, even with appropriate treatment being given. When a vaccine has been given to your pet, their immune system recognises that there is an invader, which is considered to be a threat to them. In response, the animal's lymphocytes, that's a type of white blood cell, produces antibodies in order to kill the pathogen. If your pet subsequently encounters more of the same or a similar organism, again the immune system will react and fight off the infection. However, over time that level of immunity your pet has fades. There are many different types of vaccine for use in different types of pets. Making sure your pet is fully vaccinated is necessary to ensure that they have the best possible chance of not contracting any diseases that could prove to be fatal. For cats, vaccines are available against feline enteritis, 2 cat flu viruses, chlamydia, bordetella, feline leukemia and rabies. Dogs are routinely vaccinated against distemper, infectious canine hepatitis, parvovirus, parainfluenza and leptospirosis. In addition to this, we recommend that if you're planning on putting your dog in a kennel, that they will often require a kennel cough vaccine against bordetella. Alternatively, if you plan on travelling abroad, a rabies vaccination is strongly advised or maybe even mandatory. Rabbits are vaccinated against viral hemorrhagic disease and myxomatosis. The timing of primary vaccinations is catered for animals according to whether their maternal immunity has faded quickly or lasts a bit longer. Very young animals have antibodies passed on from their mothers. These are known as maternally derived antibodies. If these animals are still present when you begin your pet's vaccinations, these antibodies can mop up the vaccine components and prevent an effective immune response. With diseases such as leptospirosis, we know that dogs need to be given 2 vaccinations in order to generate immunity in dogs of all ages. Many people tend to wonder if annual vaccinations are actually necessary. The answer to that is kind of yes or no. Remember, we said your pet's immunity fades with time. This occurs at different rates for different conditions, so though your animals are vaccinated every year, they won't necessarily be vaccinated against every condition every year. For example, in dogs, we know that leptospirosis and parainfluenza, in that immunity fades very quickly, but that distemper, parvovirus and hepatitis immunity last longer, and it's therefore only included in vaccinations every 3rd year. An independent body, the Veterinary Medicines Directorate, oversees licences of veterinary medicines in the United Kingdom. Vaccine manufacturers are required to submit a summary of product characteristics, otherwise known as an SPC. The SPC clarifies how the product behaves based on scientific evidence, as well as giving an indication of how long immunities are known to last. The VMD decides whether the SPC information is correct. Another important consideration when looking at the frequency of vaccinations is something known as herd immunity. Herd immunity looks at the percentage of the population that is immune for a given disease at any time. If herd immunity were 100%, infectious organisms like bacteria and viruses will not be able to infect anyone at all. Typically, herd immunity in our pets is as low as 30 to 50%. This enables conditions like cat flu, distemper, hepatitis and parvovirus to remain in the population. It's therefore no wonder that we in Swindon still see dogs with parvovirus, which is a highly contagious disease affecting dogs of all ages and can cause a horrific death, or if the dog survives the acute phase, a long-term illness with malabsorption and often chronic diarrhoea. There are other advantages of having regular vaccination. For example, it allows us to check your pet at each vaccination. This facilitates the detection of problems that your pet may have, allowing us to treat your pet accordingly. This will benefit your pet greatly, as issues that are detected early are more likely to be easy to treat. If you are concerned about over-vaccinating your pet, it is possible to have some antibody levels checked to see if booster vaccinations are actually necessary. Some animals may produce an immune response which lasts slightly longer than the vaccine schedule suggests. However, the results aren't completely reliable, and they can be quite expensive, particularly if you test for multiple diseases. So what do I do when it comes to my pets, and what do my staff do when it comes to vaccinating their own pets? Well, personally, I believe that vaccines are a safe and efficacious way of maintaining my pet's immunity and protecting them from unpleasant and life-threatening diseases. I therefore vaccinate all of my own pets at the recommended interval, and so do all of my staff. As always, if having watched this video you have any questions, then please phone or email the surgery. We're here to personally help give you the very best advice and treatment possible for your much-loved pet. Thanks for watching, and any feedback regarding this video will be very much appreciated.